Growing up, I had a family that was so part of American history and fighting on behalf of those who need a voice. It's helped shape what I do in my life. It's helped give me a sense of what is possible in terms of fighting for social justice. Nowhere more now do we need to give that voice to people who are suffering from mental illness and addiction, where they are treated as pariahs and discriminated against as a result. If these were cancer or heart disease, we would be intervening in ways that we know work. It's about taking care of all of us because these are Americans. They're dying every day and they're our brothers and sisters. We're not seeing a spirit of let's look out for one another in America today. We're seeing a spirit of I've got mine, how about you fight to get yours? That's not the America that I grew up in. It's not the family that I came from. 50 years ago, President Kennedy said the mentally ill need no longer be alien to our affections or beyond the help of our communities. And when he talked about the moral challenge of his time, civil rights, and he said, who amongst us?
And who among us would be content to have the color of his skin changed and stand in his place? Who among us would then be content with the counsels of patience and delay?
Today it could be said, who amongst us would trade their illness for a mental illness or addiction and be content with the double standard of care that they get? When I got elected to the United States Congress, even though I was the youngest member from the smallest state, I was still able to make a difference.
When he was elected to Congress in 1994, Patrick was struggling not only with alcoholism, but with mental illnesses.
At the time, I had grappled with these issues and had felt the real stigma because I never wanted to tell anybody.
Patrick Kennedy is now leading a political movement to change the way people view and talk about mental illness and addiction.
Let's pass mental health parity. When we passed the mental health parity law, I was under the mistaken impression that when you passed a law, it's the end of the story. Obviously, I learned that's not the case. The story's only beginning. The new frontier is breaking the shame that we have as individuals who suffer from these illnesses. The mission of our efforts at the Kennedy Forum today is to unite the community of mental health around President Kennedy's original vision upon the signing of the 1963 Community Mental Health Act. We started One Mind for research because I believe the science piece of this is what's going to drive the service delivery. And that means we need all the tools on the table so that we can treat this illness. And for some, like insulin would be given to someone with diabetes, opiate replacement therapy should be given to people with opiate dependence and addiction. How can we ignore doing what we know works to improve someone's mental health now that we understand the neuroscience behind it? Our job is to bring our case to the insurance community, to elected officials. Right now, insurance companies are really in the throes of denial. They have no insight to how their decisions are so dramatically affecting the population as a whole. That is why we've launched the Parity Track and parityregistry.org in order for patients to have a venue to tell their stories and understand that there is help for them to seek redress for the denials of care for mental health and addiction treatment. We need better outcomes. We're not tolerating this denial anymore, or else we're going to continue to incarcerate people with mental illness and see escalating suicide or overdose rates.
I thank you for this fine young American who has devoted literally his life to a cause.
You didn't have to do all the things that you have done, but you did because you recognize that this was a need that our country has had for a long time.
And it was actually Patrick and not me who first said this is a civil rights issue, and I agree.
We need new medical civil rights movement for mental illness and addiction.
Because of Patrick's efforts and the colleagues who worked with him, it's easier for millions of people to join him on the road to recover.
If we create a new normal, then future generations will not grow up in a culture which dismisses people with these illnesses. If we get this right, we will fundamentally change the way we treat people with mental illness and addiction in this country.